Hi, this is Steve from Musculoskeletal Specialist. This is the physics of fascia. This is intended to be the first of many lectures and hands-on manual therapy demonstrations that we're going to put out in our musculoskeletal manual therapy online program. And so the intention of this is to lead that. I'm also using this as an introduction to our full body musculoskeletal manual therapy treatment that we call the maintenance treatment. And the maintenance treatment is it's a procedure of getting through the entire body and working through all muscles and joints and getting your hands on the fascia and making changes. But it's where you start. It's a starting point. It's a whole body treatment. And so about 75% of your patients will be fixed up by that treatment, and the other 25% will need more specific work. And so this physics of fascia is a real fundamental starting point for both of those things. If you're going on in the program and you're thinking about doing more advanced manual therapy and getting into the 7 systems of the body, you really need to grasp the physics of how it works. If you could figure out how it works, then the only thing in your way is your knowledge of anatomy. So you have the fundamentals of how things work, and you know what's there underneath the skin, and you're 90% there. The rest is palpation and your own intuition on what to do. So as a manual therapist, since the healing comes from your hands and the techniques you apply with your hands, you are the medicine. And so I can teach 10 different people the exact same technique and get 10 different results. So it really matters on your knowledge, your palpation, your intuition, how much you care about the patient's well-being. All of this stuff comes together in this kind of medicine, this physical medicine, where you are the medicine. The medicine comes in through your hands. Okay, and so what are the 7 systems? And I'm going to do this pretty briefly because we're going to go deep dive into each one of these systems. So I don't want to spend a lot of time. So muscles and fascia is the first system, and that's where we're going to start. That's the maintenance treatment, muscles and fascia. Scars are included in that. Ligaments, joints, periosteum. So ligaments have contractile tissue. Ligaments have contractile tissue that takes 3 days to contract. And so your brain is speaking to the ligaments, and the ligaments control the joints. And the periosteum is the membrane around the bones. And that membrane is very innervated with nerves, and the brain is speaking to the periosteum because the brain and the nervous system are one thing. And so we want to be able to treat all of these systems and treat them effectively and in a simple way. If the treatments are really complex, there's maybe something wrong there. So you want to approach things in a very simple way. Keep it simple. Okay, nerves, veins, and arteries. So you got your vascular system and you got your energy system. So nerves transport electrons, and so does your entire fascial system transport electrons. So the dura membrane, the dura mater, this is the membrane that encapsulates your spinal cord, it encapsulates your brain, and is continuous with all of your nerves. This is an incredibly important piece of stability. It's a thick, stabilizing component within the spine, and it holds trauma like no other. If there's a trauma loop, your brain is signaling trauma down your body. If the dura is traumatized, say in a whiplash or a car accident, even emotional trauma will get the dura, your nerves will not have glide. Okay, the viscera, that's your organ system. Now you stabilize on your organ system. You use your organ system for each of its particular function, and then they relate to each other. And so we need to be able to attack the viscera and get that all cleared out and moving. Exercise. This is neurological exercise. This is how does your brain tell your muscles in which order to contract to stabilize you? How does your diaphragm participate in stability, right? That's what we're talking about with exercise. And then the brain trauma system. And so This is our most important breakthrough thing. We hacked the trauma code. We can find trauma in the body and make it stop looping. And so say you sprained your ankle and you're stepping on that ankle, say it's been a year later, you're stepping on that ankle, your brain gets a signal. So when it gets that signal from your ankle, it does a calculation on the signal. It asks like, is it dangerous? And if it thinks it's dangerous, and it may, because it's like, well, last time I had this pressure, I had a sprain, there was an injury, your brain will signal a signal back down to the body to guard that ankle. And that guarding causes body-wide tension. The tension is fight or flight. And then a freeze response, the muscles let go, but your insides ramp up. So if your muscles let go as you go into freeze, well, your adrenals are cranking, your heart is cranking, and everything is ramping up on your insides. And so we have found a way to track that, to test trauma in the body, all of these little traumas, emotional and physical traumas, and turn them off. And it actually works. And that's part of our school. And we're hoping that we can take people through all of these systems and then finally land them on our MSK neural reset, which is the best treatment I've ever seen. It's absolutely astounding because you can release muscle from the brain, the dura, viscera, nerves, veins, and arteries. You can do all of this stuff from the brain. I'm going to talk about one patient we had like last week. It was an elderly woman who got chemotherapy. And if you ever worked on a chemotherapy patient, their veins are rock hard all the way through their arms, and it causes a lot of pain. And she couldn't raise her arm because she had cording through her axillary through the armpit. And cording is a literal cord of fascia. We did the neural reset on the chemotherapy. We did her whole body. We found, about 70 trauma points in her body. And we did the neural reset on her, the MSK neural reset. And when she got off the table, 80% of the pain was gone in her arm. The veins were soft. The cord was almost unpalpable. And then when she went home within like 2 or 3 days, she was 100% better with no pain in her arm. And she was waking up throughout the night in pain. And so we worked that through her brain, not through her arm. And I've worked on these chemotherapy patients many times, and is nothing as good as the trauma treatment through the brain. And we're going to hopefully show you how to do that at the end of the school. That's the last class. And the reason why it's last is because you got to know everything else to do it, actually. Okay, so this is physical medicine. These are some rules. Okay, 80% of muscle pain and dysfunctions are from the brain, just like that chemotherapy woman. The brain and nervous system are the same thing. Okay, this is a very important line. Muscles are tight because the brain is telling the body to guard a nerve. Your body is looking for safety, stability, and security. And so if it doesn't have those three things, there's going to be a signal from the brain to guard, fight, flight, or freeze, right? And freeze ramps up your insides. So it's just as bad as body-wide tension. Okay, so veins, arteries, your lymphatics, organs, the periosteum all have nerves, and they all get extremely tight from this neurological guarding, right? That's why our lymphatic treatment, and we're going to show you the lymphatic treatment we do is based on osteopathic medicine. We're working the nerves, we're working the brain, okay? So we test, we find the trauma, we find what makes things tight, and then we reverse it. Okay, trigger points are guarding action from the brain. That's a signal straight from the brain. So you can use trigger points to do assessments of the body, like a diagnostic, to find out where the problem actually is. That's what trigger points are really valuable for. Okay, here's 3 laws. Okay, the law of Hilton. Nerves that supply muscles also supply deeper joints, organs, and the skin above. And so why is this important? This is really important. If somebody has a problem on their arm and the arm is tight, and say this is tight or the joint is tight, or you're working their neck and you can barely get your hands on them, you can barely touch them, and you don't have the brain tricks yet, what you can do is you just barely lift the skin, just barely lift the skin, because that nerve innervates, is electrically supplying electrical information to the muscle below, the bones below, the joints below, everything below it. So you can get deep into the body from far away. And so what we can do is barely lift the skin, and you can try this on a trigger point. You find a trigger point and don't press on it. Release the trigger point with this technique. And so barely lift the skin and move it back and forth. Do very light skin lifts and just work that until you'll feel the skin starting letting go. You'll feel the muscle below start letting go. And then you'll feel, if it's a trigger point, you'll feel the trigger point start to melt. And so trigger points are great to practice on, because try to release a trigger point without pressing on it using this law of Hilton. So you can get some hands-on experience of this law in action. And we throw this law into all of our treatments throughout the entire program. Okay, Wolff's Law. If a load on the bone increases, the bone will remodel to become stronger and more resistant to forces. Also, it will create bone spurs if there's an asymmetrical joint. And so if your pull on a bone is not exactly the same on all sides, and it's getting pulled at some weird angle, the bone will remodel and grow towards the asymmetrical tension, and you will get bone spurs. And that is the bone spurs. And so an asymmetrical tension on a joint is bone spurs, osteoarthritis, and dysfunctions that will cause other improper stability patterns. So if your shoulder is not fully stable and centrated in the joint, you're going to have a instability in, say, the opposite hip, because the opposite hip and the shoulder are talking to each other, trying to stabilize each other through this X through your body. That's your fascial slings. Okay? Pain is in the brain, not in the body. Okay? Pain is in the brain, not in the body. So in the end, we're mostly treating the brain. If I'm rubbing somebody's pec, trying to get the pain out of their brain is fully engaged in what I'm doing. And so with the MSK reset, what we're doing is we just turned it upside down, and we're working from the brain down. And I've got some demonstration videos coming where I release somebody's hamstrings just from working on the brain, the cranial nerves, and the reset trick. And you can release muscles, you can release joints and the whole body through the brain. And that's a major breakthrough. Okay, so here's some types of tissue. We're going to talk about fascia here. So here's some type of tissue: skeletal muscle, cardiac, and smooth muscle. Smooth muscle is like your digestive system. There's nervous tissue, including the brain, that conducts all your electrical information. But what I'm reading here is like the traditional definitions. Also, the fascia conducts electrical information. There is a pretty large piece of evidence, meaning we know what fascia is now, and I'm going to show that it is a continuous electrical system, and it's all talking to each other at the speed of light. And the fascia is an amazing tissue, and it's everything you're made of. So number 3, the epithelial tissue, that's the lining of your organs and your guts. It's one cell wide. So that tissue, say in your stomach, in your intestines, sloughs off, and every 3 days you get a new lining. Okay, and then connective tissue, that's the framework. Now we're talking about fascia. And again, this is the traditional view. Adipose tissue, that's your fat. That's a very metabolic tissue. You actually need fat. And so the amount of fat you have on your body, say the aesthetics, the look of your fat, are just the cells are just larger, right? And if you lose weight, you're not losing fat cells. The cells are smaller, right? That's how that works. And you need those cells. They're very metabolically active. Okay, veins and arteries, that's tissue. And then fascia, which is everything, right? That's the structure. It's the net that everything is built out of. Now, if you look at this skeletal muscle diagram that I have here, and it has this extrusion from smaller to smaller tissue, all of this tissue is built from fascia, right? As it comes out, the lining of the muscle is fascia. The net that everything ties to is fascia. Then you got this fascial web. So this is your net. And it crisscrosses and it does all this crazy shapes. And so what we got is this net. And Strolling Under the Skin is a must-watch. You can catch it on YouTube. It's called Strolling Under the Skin. Jean-Claude Jumberteau, he's a French guy, just butchered his name. Watch that video and you're going to see the living matrix within you. So now Jumberteau, he was a hand surgeon, and so he went into the hand in patients that were awake with a microscope, and he was in there with the scope and they were moving. And then so it was the first time that you could actually see fascia in the living being. And it's not some dead tissue that's laying over top of your muscles. It is a living matrix changing shape. It's tied into the brain directly, and it's morphing within you to accommodate your needs. It's alive. And if you can think about it as a living tissue and it's able to morph and change shape, you're going to understand what you're feeling when you palpate the body. And as you're touching things and things start changing, you're going to understand that, oh, it's moving, it's changing its shape based on my inputs. And if you know that it's a living matrix, you can start talking to it intelligently and starting to motivate it to make the changes towards a healthier state. And so there's your fascia. And now in between the fascia, muscle comes in, and say that's a muscle, which is made of fascia. And all that does is add contractile tissue to it. And so it can pull the fascia together. And then you have the opposing muscle, which pulls it the other way. And so muscles only contract. So you have like your bicep tricep relationship, right? And so fascia is built. Fascia is the net of which everything is built. Okay, so what does fascia do? What's the functions of this thing? And I've got some pretty good pictures coming up. So it provides the matrix that makes you, right? Your brain, your fat, everything is built into this fascial net. And you can say there's 7 layers of fascia. You got the superficial to deep, different layers of fascia, but it's continuous, right? It's like saying there's 7 notes, musical notes, when there's a lot of different sound between all those notes. That's the same thing. But we need to be able to define things in a way that we can have a conversation about it. So, okay, it provides attachment sites for the cells. It provides a pathway of nerves for blood, for lymphatics. It provides continuous electrical connections throughout the body, provides restraint mechanisms. Now we're talking about ligaments, right? Like check ligaments. Like it stops your joints from moving so far. That's the ligament. It stops that motion. Where connective tissue is loose in nature, fascia provides movement between structures, right? We're talking also we're talking between organs. There's looseness between the organs, but they can only go so far, right? That's fascia that's controlling that. The interosseous membrane, that's a membrane between like your bones. You have one on your leg and one here on your forearm. And when you rotate, that membrane in between there holds those bones and checks that movement. It's also vascular and nervous system going through there. And if somebody has tennis elbow, you really want to look at the interosseous membrane, right? That's part of that treatment, is treating these membranes. Very important, okay? It houses 1/4 of all your bodily fluids. It's a lot of fluid, and you're mostly water, and the fascia is dripping with water. And so when you watch Strolling Under the Skin, look at the tubes as what he's showing you, and they're full of water. They're literally dripping with water. Okay. Fascia is a major arena for the inflammatory process. And I think when you know this, if you wake up in the morning one day and you just ache all over your body because you took some medicine that disagreed with you, you had some food or you too much to drink, and you ache all over your body. You're just stiff. That is inflammation within your fascia. And this happens all the time. And the fascia is a transport system for infections, and bacteria can get in there and viruses can travel through the fascia. Okay. There's some evidence that cancer can travel through the fascia. Okay. Fascia and proprioception. Proprioception is where you are in space. If I have my hand up in the air, my brain knows where my arm is. Whether I'm upside down, I'm underwater, doesn't matter. It's like, okay, I know where my arm is. That's proprioception. It has to do with your balance and your system of just knowing where you are. Like if you are a toddler, 3 or 4-year-old, you're not so good. They're always bumping into stuff. They're falling down. And that's their proprioception. Their body's learning where they are in space. That's proprioception. And that can fall off as you become elderly. And a lot of that has to do with tension of the dura membrane, right? And the RCP min, rectus capitis posterior minor, these little muscles back here, they are feeding huge amount of information down to your feet to tell you where you are and maintain your balance. And so with the elderly, we really want to look at proprioception and aiming the treatment towards improving that, because taking a fall is a big deal. What we do with our elderly is we make sure that they can get on and off the floor without assistance, and they have confidence walking like they're not going to fall down, right? And so it's balance. And a lot of that has to do with the manual therapy part of it is the dura membrane. And this RCP min and that tension, you can see when they get that deep forward head posture, their balance is the first thing to go. They forget where they are in space. They lose connection to their feet. Mechanoreceptors, there's a lot of different receptors in the body. And I think you can probably overthink this, right? And so I'm not going to go into all the receptors because is it relevant clinically? And so my goal is not to bomb you with all the information that I can, but to give you information that you can take and apply in your practice right away. And as you do treatments, the information I'm giving you will help you find out what's wrong with a patient and to reverse that. And so I'm not going into all the different receptors, right? But they're mechanoreceptors. They send signals to the brain about pressure and distortion to tissue. Now, nociceptors are pain receptors. They send the information to the brain that there's pain. But keep in mind, the brain is in charge of pain, and it will do a calculation on any signal that comes in and decide whether or not that signal should give the system a pain sensation. Because if it gives the system a pain sensation, they're likely to do something about it, right? And it's a history. History has a lot to do with pain. And we're going to get into some pain science, but not today. Okay, and the receptors we really worry about are at the musculotendinous junction and like the Golgi tendon organ and these guys. And so we'll get into those a little bit, but in practice, that's what we're attacking as those Golgi tendon organs. And we have all kinds of ways to get the brain to get involved in the treatment, to get tension to drop off. And I'm telling you, sometimes you don't even need to touch the muscle to make it happen because it's in the brain. Okay, so I'm going to go into some laws. And there's 5 natural laws that I want to talk about that govern the universe, but they also govern your body. And if you understand the laws, you'll understand yourself more, you'll understand your friends and family more, and you'll just be a better practitioner because you're going to see the body expressing itself this way, and then you'll be able to work with it. You got to work with these laws, okay? So the first law is the law of polarity, okay? Everything has 2 poles. Opposites are the same, okay? So opposites are the same, right? And so I've got this end of the pole here, like a -6, and on this end, there's 6. Now, this could be bad here, and this could be good. whatever you think is bad and whatever you think is good, they are on the same line, right? It's a gradation. And then there's degrees. So this is -5 bad, -4, -3. Oh, it's getting better. Oh, now I'm neutral. I'm not bad, or now I'm not good. Now it's getting better. 1, 2, and then, oh, I really like this. This is great, fantastic, and absolutely dynamite, right? And so what happens is somewhere there's a polarity going on within your body, within every system, and the brain. So you've got the brain up here speaking down to the body through these channels, and it's going to get a piece of information. And the information is just an innocent piece of information, like pressure, somebody pushing on your pec. And it's going to go up into your brain, and your brain is going to rate it on the scale of polarity. And it's going to just give it a rating. Okay, and your brain is going to rate it on a scale of this polarity of bad or good. But look, now polarity leads into the law of rhythm. Now there's a rhythm. Now I'm going to redraw that number line. So there's your number line there. That's the same. So you have polarity here, right? And if you apply rhythm to it, right? So you've got super good and super bad, and your brain's getting a signal, and it takes a calculation on it, and it drops it into the polarity number line, right? And then so what happens is there's a rhythm to it. And so say you came this much good, the body is going to move it down to the exact same location on the opposite side of 0. That's 0, right? And it's going to land there. And then it's going to stay there. And then it's going to come back. And then it's going to go back and forth like this. Now, I want you to think about this. So there's polarity and there's rhythm. If you look at people you know, you're going to know some people who are, say, bipolar, right? Say, so what happens to that person who's bipolar? What happens is they swing to extremes. Like they'll have like a day that's like a 6 good. It's the best in the world. What'll happen to that person is they don't know how to navigate the whole line. They drop right to the very opposite extreme. So they're either 6 or -6, and then they're back to 6 and they're back to -6. Very rarely do they land right here, right? And that's your toddler too. Your 3-year-old, 2-year-old. If you take a 2-year-old and they have like an incredibly good day, like he went to the pool with a bunch of kids and they just had the best time in the world, what's going to happen is, as a parent, you probably know this, they're going to have an equal and opposite swing. That's the rhythm, to the equal and opposite side of polarity. And they're going to have an absolute meltdown that night. And that's just being a toddler, right? And so your bipolar people, they do the same thing. And so the goal is, emotionally, the goal should be, is to be able to control this line and control where you're at with in terms of polarity. And so that's the law of rhythm. And now, so this law continues because throughout the body, every organ has a rhythm. Every vessel has a rhythm. Every nerve has a rhythm. Your spine has a rhythm. Your brain has a rhythm. Your lymphatics, your heart, everything has a rhythm. And so what I mean by that is, if you've got your liver and you got your stomach and they're tucked up like this, liver and the stomach's up underneath that, they rock on each other in a mobility, right? Mobility is like the liver's ability to move in relationship to its surroundings. And so it can move in relationship equal and opposite to the stomach, right? And so motility is the liver's ability to move among itself. So it's just sitting there making its own movement, because movement is life. and everything has its own motility, its own innate movement. And so that's moving. And then so there's motility, the liver is moving, and there's a very specific rhythm to that. Or the rhythm could be broken, and our job is to reinstall the rhythm and then get the rhythm of the mobility between the liver and the stomach and work on that and make sure all of that's aligned. Now, what affects motility more than anything, in my opinion, is the presence of electricity. And we're going to talk about how to add electricity to the body here, and the trauma guarding tensions on the vascular and nerve vessels that go through that organ. So I can increase the motility of the liver by dropping the trauma loop in the brain. And we do this all the time. And I'm hoping we'll have some people who take this all the way and can take on these treatments, because, man, people need them. So that is rhythm. Oh, one more thing about rhythm is when we work the nerves and you feel the nerve, you're going to feel the nerve come out of the spine and then back in the spine. They make this rhythmic movement out and in. So they'll extend out, they'll retract in. And it's part of our frozen shoulder treatment is to reestablish the rhythm, work on the neurological trauma, and reestablish the rhythm of the shoulder joint. And so there's rhythm to your bones. And so here's something for you to do. You're going to grab the pinky side, that's the ulna right there. And so you're going to want to pause this video just for like 30 seconds and pinch the ulna. Now look, you don't pinch it so hard that you squeeze your fingers. Just dent the finger pads. If you squeeze too hard, all you'll feel is your own fingers. And you're going to restrict the movement, the rhythm of this bone. So you barely touch it, just enough to get the signal of what's going on in there. And you wait, and there's my ulna in its expansion phase. It's getting larger. And then about 3.5 or 4 seconds, there it goes. It's getting smaller. And so it's doing this, and it's alive, and it has its own rhythm. In our treatments, our goal is to reestablish rhythm. And the polarity comes in because what if it's expanding more than it can retract? What if the nerve is coming out farther and it can barely get in, and it can only go one way, and it's fighting that? Your job is to reestablish balance in the polarity and put the rhythm back in. Right? And we coach the body, kind of coax it in the right direction, and it takes it right over, right? It'll do it. You don't have to think too much. It's actually pretty darn simple. And so that's what we're doing. Okay, this is another natural law. It's the law of vibration. Now, we've talked about polarity. Everything is swinging from one side to the next. Rhythm is that continuous movement that is inside you. When you lose all that, that's called being dead. Okay, so this is a law of vibration, and everything in the universe is vibrating. And with palpation, you can tune in to these vibrations. You can feel it because you're vibrating and the patients are vibrating. Now, so really, what does this mean? Okay, nothing is at rest. Everything moves, vibrates, and the level of vibration controls how something is observed. And the best example that I've ever seen was this one, and I'm going to share it with you. Now, if you have a top, this spinning top here, this picture of this guy, and you spin the top, right, you're going to hear a sound, right? It's going to be a low, whoa, whoa, whoa sound. And if you make it go faster and faster and faster, what's going to happen is that sound is going to start changing. It's going to go higher and higher and higher pitch, right? And so what's going to happen is the sound will travel through all the musical notes that we know of, everything possible between each of the sounds between the musical notes, until it hits finally the threshold of your ear where you can no longer recognize the sound, and then the vibration will leave your comprehension and you will no longer hear it. And so with the visual, it does really the same thing. So it'll spin, so you spin the top and you can see it, but if you can get it going fast enough, it will travel through the speeds of what is the electromagnetic spectrum right here in this picture. And so based on the wave, the vibratory rate, you will experience that differently. And so if you spin the top, that same top that went through all the sounds, now let's take that and let's travel that visually, right? And so if you can speed it up fast enough, that top will turn red. It'll be at the frequency of red. It goes a little faster, it'll go orange, a little faster, yellow, keep it going. It's going to go green, blue, indigo, violet, and then it's going to go ultraviolet. And then suddenly you're not going to see the top anymore because it's no longer compatible with the wavelengths of your eyes, right? It's going to appear to have disappeared, but it hasn't disappeared. So it's lost your ability to hear it, and you lost your ability to see it because now it's out of your little tiny visuals and audible spectrum, right? But it's going to keep going up. And so it'll travel through these ultraviolet frequencies. It'll hit like milliwave. That's the airport. When you go to the airport and they look at your body through your clothes, that's the milliwave. I was actually in the group that invented that. Then it'll hit X-rays. As it goes faster, it's going to hit gamma rays. And then eventually it's going to go so fast that we don't really know what happens to it. And that's where you get in philosophical arguments that nobody can prove. But it's a super interesting argument. It's gone. But what happened to it? It's sped up beyond our known reality, right? And that's vibration. So you can do a gamma spec on a material where you use a machine to read the wavelength coming out of the material, and you can tell what that material is based on its wavelength. And so the vibration dictates what the structures are, how they behave, and how we observe them. Now, everything in the body is vibrating. Everything in the body is vibrating. Now, if I control the vibration, if I put a dampener on a cymbal, you hit a cymbal and it's like making this sound. If I dampen, I'm going to change the vibration. I haven't changed the cymbal, but I've changed the way that we audibly understand it, right? It does sounds different, right? And so tension through the body affects the vibration. Say your liver, you're trying to work the liver and bring that liver back to life. If it doesn't have its vibratory freedom, say that all the veins within it are hard as a rock because you've had chemotherapy or you're eating foods that you're allergic to, or you were in a car accident and you got punched in the liver by a car. We've seen that like 2 days ago. Liver just completely froze, ribs broke on top of it. That's going to stop the natural vibration of the liver, right? That can't be good. It's still a liver. It's still vibrating on some level as a liver, but it's not going to function well, right? And so the law of vibration is really important. Okay, so the next law is the law of cause and effect, right? Now, there is no such thing as chance. There is a cause to every effect. Now, I'm using the roulette wheel because it's supposed to be a game of chance, but it's not a game of chance at all, right? If I throw a ball into this roulette wheel and it lands on 8, and we got it and it's on 8, the reason why it landed on 8 can be reversed engineered to the point where it's down to the sweat on my hand when I release the ball and the amount of drag when it left my finger. So the exact velocity of the ball hits the wheel, the how fast the dealer spun it, its velocity, the angle of the attack of where the ball landed in the wheel. You can reverse engineer that and come up with exactly each cause that had that ball land on 8. And so there are things in the body that happen, pathologies. And I'm going to give an example. We had a young woman with 3rd stage kidney failure, and she was looking at some pretty good medications and a lot of doctor's appointments. Right? And so what is the cause? And so I'm looking at it from a musculoskeletal physical perspective. She's got her doctors looking at her blood work and really watching all that. And so I'm just looking at the physics. Nobody else is looking at the physics, so it's okay. So what is the cause though? So I'm like, okay, what could be causing the effect of third stage renal failure? And so you start peeling it apart, right? You start peeling it apart. And on her, we found the cause was a vein was pinched, descending from her kidney. We just unpinched it and did our kidney treatment. And a week later, she had all of her blood work, and her blood work was all normalized, right? And so each pathology has a cause. If somebody got cancer, you could link that somewhere in their life to what caused that. There is no chance. And so no matter how complex a patient seems to you when they come in, you can suss out all of these little causes and reverse this one, reverse that one, reverse that one, and say, eventually, hopefully, if you're good and the stars align for it, you can help these patients recover from pathologies and their pain patterns, right? But you have to give up the idea of, well, that's just the way it is, right? That's just not going to work in medicine, and not the medicine that we're doing, right? We have to be like pit bulls and lock on to the problem, and you don't let go until you solved it, right? You go through the 7 systems. You start with muscle and fascia, and then you just keep going through the systems until you find the one that actually got it, right? So there is a law of cause and effect. This is the last one I want to talk about. It's called the law of correspondence. It's fractal, right? And so what it means is, as above, so below, as below, so above. And why did I add this law to this talk? Well, because I can't look deep into the body to come up with treatments and ideas. What I can do is look at, how does the universe work? And since the law says, as above, so below, as below, so above, I can assume that the human body will work the same as these higher systems. And it does. It absolutely does. You can chase it all the way down. That's called fractal. So fractal means it's the same as you move up. Fractal is the law of correspondence. Okay, this is fascia under the skin right here, right? And you can see this tissue, it's full of fluid. All of this inside of this structure is water, right? So it's the water that's giving fascia its shape, plumping it up. Okay, we'll take it up. Well, what's giving a cell its shape? Well, the water inside of it. A cell is like a water balloon. It is the shape of the water inside of it. Well, what gives you your shape? Say your abdomen, your belly. Well, the water inside of it gives you its shape. And there's pressure. And so there's inter-abdominal pressure. What really is behind that pressure? The water is behind that pressure. And so it's fractal all the way down. And so you stabilize on water, your cells are stabilized on water, your fascia is stabilized on water. And so one of the main parts of the maintenance treatment that I'm adding is, how do we look at water and maximize its structure? Can we make the water structured in a way that is most beneficial to the body? And we do that. That's the big difference between what we're doing and massage. And it's big enough to be an entirely different kind of treatment. So that's fascia under the skin. This is an old picture. I think this was taken in this is in the 1960s. This is cytoplasm of the cell. And so the structure of the cytoplasm of the cell is identical to the fascia under the skin. That's why I know this picture is not faked. And then bone. You look at bone, it's identical. Look at the shape of this, that, and the tuberculous shape of this bone. The only difference between bone and fascia is it's moving a heck of a lot slower. Right? It's mineralized material, but bone is always coming and going. It's always coming and going because Sometimes phosphorus is leaving, sometimes calcium is leaving, minerals are coming and going, your immune system's made in the bone marrow. All this trabeculae is just full of blood and lymphatic tissue that's going to become your immune system. So bone is not dead. That's why I hope this demonstration of squeezing your ulnar bone will tell you, like, well, there's something going on here because this thing's moving. And if you can't feel that moving, and you're in the class, you need to let me know. That's an email, so I can give you some palpation exercises. Okay. Okay, so phase transitions. This is another, this is just how the universe works right here, phase transitions. Now, I want to say this one thing is, like, I'm going to talk about this stuff, and you may be wondering, where am I going with this? What does this mean? All of this translates to working on the human body. Okay, I'm going somewhere with this. I just really want you to understand it from the ground up, because the more you understand this, the simpler your treatments are going to be, the more you're going to understand what we're talking about and how we came up with some of these treatments. Some of the treatments we're going to give you are classics. They've been around forever, but we've got some really good new stuff based on the physics of the body that I'm sharing you here, especially our vascular work. That's all brand new. And of course, the MSK neural reset's all brand new. But it works really fast and really simple. And that's the way healthcare should be. You go to healthcare practitioner, the treatment feels good, and you feel better when you leave. Like, that's how it should be. Okay, so this is the periodic table of elements. So all known elements of the universe are made of 92 of these things. And so 92 lands you at uranium right here. And so this 93, 94, all these higher numbers, these are all synthetic. Man has made these. And so that explains, like, say plutonium. And so you've got plutonium at 94, and they're radioactive. And being radioactive means they're throwing off protons and electrons to try to go back. So I made plutonium, I'm trying to go back to uranium. So they're trying to be unmade, and they'll be unmade over time. You give it, a couple 200,000 years, and plutonium goes back to uranium. Everything in here is exchanging electrons and parts. And so how do you get all of everything you see in your reality when you go outside and look at all the different variety of things? How do you get all of that stuff out of just 92 elements, right? And so that's a pretty good question. And so I'm going to answer that. And it relates to the human body, of course, because that's why I'm talking about it. Okay, so this is a pressure temperature phase diagram of carbon, which I lifted off a friend of mine who works at Los Alamos. Okay, so when temperature rises, you end up on the higher end of this graph. And then when pressure rises, you end up on the higher end on this plane, right? And so at this line here is called the plastic phase, right? That's plastic. And plastic means the ability to deform. Plastic means the ability to change shape. And so your body is plastic, or it's not. Our job is to reinstall its plasticity. But with carbon, you can have over here at this low pressure and under 4,000 Kelvin, you will have graphite, right? And graphite, so carbon is just like a piece of charcoal, right? And then so if you add heat and pressure, it'll turn to graphite. And graphite is this slippery powder, right? And so, but if you add temperature and pressure to it, and you pressurize carbon, and you pressure it, you'll get to the point where the molecules reform in a very geometrical, strong shape, and you'll end up with diamond. Atomically, it's the same. Graphite, carbon charcoal, and diamond are all made out of the exact same thing. It's just how did it reorganize itself? Now, I'm taking this carbon here and I'm going to add some pressure. And as I add pressure, it goes through the plastic phase, right? And it's going to hit this line here and it's going through the plastic phase. And when it's on the line, it's literally changing shape and morphing, and it's nothing. It doesn't know what it is and what it's going to become at this point. And if you can keep the pressure on and cool it slow enough, it'll form and it'll maintain that diamond shape, right? And so because the universe is fractal and the law of correspondence, somewhere in this phase diagram is a little piece of you and a little piece of us. And when we're going through life, we're going to get pressure, we're going to get heat. And when we get that heat and pressure, we go through the plastic phase. And that phase is that time where you don't know what's going on. It's the dark night of the soul. You're changing. You could go either way. You could go up in here, become a diamond, or you can go back down there and become a piece of charcoal, right? But if you can maintain it and you understand, like, this is the plastic phase, I'm going to make it through it, you can attain this, right? And so as below, so above, as above, so below. You are on this chart, right? And so we are going to put the body itself with our hands through a phase transition. And the maintenance treatment is really aimed at electricity and phase transitions of the body using physics, using the physics. Okay. So our goal is to take what we've talked about, take these laws and put them into treatment. And then as you do treatments and you understand like some basic techniques, you can start being creative based on your knowledge of anatomy and experience. And you can start creating your own techniques, and then the success really comes in. What we're going to give you in class is a procedure, step by step by step. And our goal is to not turn you into a robot. Our goal is to give you a starting point. I'm like, here's a procedure, and if you do all this stuff, it'll probably work. What's probably happening is you're doing too much stuff. You're doing more than what's required. And so eventually over time, you'll know, like, well, I need this piece from this procedure and maybe that piece from this one and this one from that one. And you start like putting it together in a way that you're a musician and you're playing the instrument with creativity, but you've got your basic fundamentals behind you, right? And so we're going to go on to properties of fascia and electricity next. So this is just part one.